Okay, so again, good afternoon, and it's almost after. I'm well, it's afternoon, I guess. But let's start with the reason why the topic of my lecture is about biomimetic technique. Now, we often hear about minimally invasive, but recently we are hearing about this term biomimetic. And what is biomimetic exactly is? It is about trying to imitate what is natural. And that means we are trying to find materials that's not only minimally invasive, but at the same time, closest to the natural tooth. Okay, so um, so we have a lot of options in our clinic, and basically we have options that which one we will prioritize, whether it should be minimally invasive first, durability, uh, ease of use, of course price, and then aesthetics. So all of these options, it really depends on what is your preference. Of course, you want everything on it, and this material will provide. But the reason I am trying to, before we proceed with the main material, first, you need to have an open mind, and you have to accept the fact that there is a learning curve when you are using this material, because we are so used in using porcelain or ceramics that the tendency is that our mindset, the way we handle the material, we think it is the same as ceramic. Now, I will skip some of the introduction because I want to cover a lot of things directly to make sure that you understand this concept. Now, basically, Edelweiss is coming from composite, okay? However, even though it came from composite, okay, because composite resin is the closest material that is near to the natural. But there is a disadvantage of composite. It contains resin, which binds the filler together. Now, the problem with the resin is that it caused stains later on. And because we are the one that manipulates composite when we are placing it on our patient's mouth, later on, it can crack, it can have um, uh, certain leak that can create recurrent caries. Now, what is the technology of Edelweiss is that it created different molds that is exactly nearest to the natural tooth, and through the heat and new technology, it was able to create the mold of the coming from the composite. But what it did is that it removed majority of the resin, and then it went through laser technology. That's why there is no more possibility of resulting it to stain, because the end result of Edelweiss is vitrified glass, laser sintered vitrified glass. So this is the misconception of a lot of dentists. They think that Edelweiss is composite resin because it came from composite. But it is true, it came from composite, but the end result after the technology was applied to Edelweiss, it is now laser sintered vitrified glass. And because majority of the resin is removed, this one will not stain, precisely because it is now purely or majorly made of glass, and glass are normally the ones used by composite manufacturer as a filler. So it is not anymore composite once it is done. So I will answer now the different questions of a lot of dentists when it comes to this material. Now, this material is so flexible and so near to the natural that Edelweiss ended up using it in different ways. It was used as a veneer. It was used as a post and core, wherein the core is already on the post. And this is one of the favorite material I used in my practice, the occlusion VD. And I actually have the entire Edelweiss on my lower teeth. And I'm trying to get a schedule with my own dentist to have my upper done, because this is much better than direct restoration if your patient can afford it. Now, what I'm trying to say here is that this material, true, may be more expensive than composite, but at the end of the day, because of the longevity, if we do it right, it will actually become cheaper. So this material will be loved by dentists if the dentist's purpose in practicing dentistry is to save the teeth, or to make sure that the teeth will not be damaged more than it should while we repair it. Because majority of our treatment tends to damage first the tooth in order for us to treat. This one is the other way around. That's why this material will break first, okay? It will be the one that will fracture first if we do something that is wrong. Because the main purpose of this material is to save the tooth. So that is something that you have to always remember when you use this material. Because a lot of dentists, they prefer ceramics because if they make a mistake, it is not the ceramic that will break because it is very strong, stronger than the natural tooth. So it's the natural tooth that breaks. And because the natural tooth is the one that breaks, the patient doesn't blame the dentist. See? But why? We became dentists to save the tooth, correct? So why are we prefer for the restoration to be saved rather than the natural tooth? So because Edelweiss material, which becomes laser sintered vitrified glass, they also created a material for children, which is the pediatric crown. Okay, so let's understand the material and understand why this is one of the options that you may consider in your practice. Okay, now the normal question is that, is it strong? Okay, now as you can see, it is very important that we consider flexural strength. So what does flexural strength means to us? In terms of the material, it is how much the material can resist fracture while a force is being placed on the material itself. Now, if you will look at the flexural strength of the enamel and dentine, it is closest to Edelweiss. Now, you might ask, why do you prefer something closest to the tooth when ceramic is stronger, zirconium has a higher flexural strength? Because as I've said, if your restoration, the opposing tooth of your restoration is a natural tooth, which one, as a dentist, would you like to save? Your zirconium or the natural tooth of your patient? That is the question. Now, if it is my teeth, I will rather have a zirconium damage on my tooth rather than my natural tooth. Now, if your choice is for the natural tooth to damage, then for me, I feel that it is more on financial terms rather than really caring for your patient. Because if it is your tooth, you would rather save your natural tooth rather than the restoration that is placed in your mouth. Now, that is why we need to find a material that is closest to the characteristic of the natural tooth, so that if something goes wrong, whether it is our mistake or not, it will protect the tooth. So that is why I am telling you now that this material, its first priority is to protect the natural tooth in terms of preparation and in terms of absorption of the force when something is going wrong. Okay? So that is why, as you can see on the table, the characteristics of Edelweiss is nearest to the tooth structure. Okay. The next question is in terms of how thick it is. Of course, if you will compare a ceramic or an emax or any other material, including our composite, if it is very thick, then naturally, even if the material is strong but it is thinner, if you will break both of the material, of course, the one that is thinner will break first. Now, the next question is, why did Edelweiss created a very thin material? Because precisely as I mentioned, the first priority is to protect the natural tooth. So as much as possible, if it is not necessary, then we try to limit the tooth reduction or unnecessary damage on the tooth so that we can place our restoration. And this is the main reason why I chose this material to be put on my lower teeth. Later on, you will see my own case wherein I am an aesthetic dentist for almost more than 25 years now, and I never touch my lower wherein I have diastema, precisely because I do not want my anteriors to be having tooth reduction and cavity preparation just so I can close the space. See? So that is why when this came out, I got very interested and excited. And honestly speaking, I am very satisfied personally, as you can see on the previous videos that was shown earlier, that there's also another dentist who had Edelweiss on his entire teeth. Because precisely as a dentist, we appreciate the importance of a natural tooth. So as you can see, the incisal edge is the thickest part of Edelweiss. And it's the same on the occlusion VD, meaning it is thicker where there is a stress-bearing area, where the force is concentrated. When we chew, when we incise, when we bite. That is where the area that Edelweiss is the thickest. And then for the areas that there is no force applied, then it is in the thinnest. And that is the reason why when some dentists try to break it, I don't understand it. Why are you breaking like that? You don't break that like that. It breaks because we are chewing the lateral force. See? Uh, Zolene, do you have, there is a hand raise. Uh, do you want to say something? You can put it in the chat and I will read it later on. So the next question is, how long will it last? Now, This question is often asked in any kind of material. And I always tell all dentists, and even, in realistic way outside dentistry, nothing lasts forever, even as we die. So basically, in prosthodontics, the principle is that an optimum benefit of a restoration lasts 5 to 7 years. True, a restoration can last up to 20 years. Some restoration can last longer than 10 years. But is it still well fitted? Is it still functioning well? So what we are trying to say is that any restoration, whatever the material is, the optimum benefit that you can get out of that material, because we grow old, we use it, the tooth can elongate, the gums can recede. So the optimum and ideal benefits of any restoration that can be given to the patient is 5 to 7 years. After that, we need to evaluate if we now need to replace the restoration or if it still fits. It's just like even taking a passport picture. My photo 10 years ago is different from my photo now. How I wish I still look like myself 10 or 5 to 10 years ago. So it is the same in restoration. My current Edelweiss is now 4 years and I'm very happy. I have no problem whatsoever. I can eat anything I want. Okay? Now, the next question is, does it stains? That's the reason why I told you earlier that through its technology, it is not anymore composite resin. That's why I keep on telling dentists and other people I train that it is not composite veneer anymore. It is laser sintered vitrified glass. And glass doesn't stain. Okay? I am ashamed to say that I am a smoker. And if you can see, for 4 years, my Edelweiss never had nicotine stains. The natural tooth at the back of it, which is the natural tooth, it has nicotine stains. That is why if your patients have Edelweiss, do not use a ultrasonic scaler directly to it because it will scratch. Okay? It will scratch because it is made of glass. So, in cleaning the Edelweiss, you just polish it. That's it. You don't have to do anything because it doesn't stain. Okay? Everybody's still okay? Please give me a thumbs up if everybody's still okay. Okay? The next is, how much do you charge? Now, we have to be aware that we are dentists. A lot of dentists, even in the Philippines, they always say, oh, we go do it for service, blah, blah, blah. True. We have to provide service to our patient. But how can we give good service if we do not provide them the right materials, the good materials, all the things that we need to provide them? And this will cost money. So, of course, our service becomes cheaper if we give value for their money. So in terms of how much do you charge, it is up to you. You can charge it as much as you want. It really depends on how you charge it. Like, for example, some dentists will ask me, Dr. Jean, can we charge it like porcelain? Yes. Can you charge it like IMAX? Yes. Because it is the same. The amount of work you are going to do with this is the same amount of work you're going to do with Edelweiss. Except that with Edelweiss, you have the option to finish it in one sitting. See, that's the difference. And that is why actually Edelweiss is a very ideal material right now during the pandemic. I've heard from Wang that the number of COVID patients is increasing in Myanmar. That is the same in the Philippines. And our government is being forced to open a lot of the businesses because we are a poor country. We cannot be, quarantined for how many months because we will all die in hunger. So a lot of dentists start practicing already. So in order for us to limit our exposure to this virus, then our treatments must also be uh, uh, done in such a manner that we can limit the exposure. Now, because Edelweiss has the capacity that you don't need to have a lot of tooth reduction, so it means the use of our handpieces is less. Second, if you want, you can do it without laboratory. You can do it without taking impressions. Now, we all know that in transferring our impression, having cast, being brought to the lab, and the lab being brought to us, that is a certain communication wherein transmission of this virus can happen. Even before COVID-19, there are already disinfectants that are being used in rubber impression materials because a lot of laboratory technician gets certain or gets diseases coming from dental clinics. See, so by removing all these steps, then Edelweiss can be an ideal material to you during this pandemic. So the one-time appointment is possible. Now, the misconception of a lot of dentists, they thought they can do this in a very short time. Yes, you can. If you are like Dr. Stefan, who's been doing this for 15 years, or a lot of speakers who's been doing this for more than 10 years, that they are already trained. But if it is your first time, like my first time 7 years ago, it took me at least almost 3 hours to do the first anterior, the sixth incisor. Why? Because I'm still trying to figure out how to handle the material. And if you are going to be honest, a lot of dentists don't like reading instructions. So, because your brain is so trained with porcelain, the tendency is you handle Edelweiss like porcelain. But porcelain has a different characteristic from Edelweiss. And that's why you can do it in one appointment, but it depends on how fast you can do it in terms of how long you will be able to install, prepare, and do everything else to make it correct when it comes to Edelweiss. Now, the next is, why is it biomimetic? As I mentioned, Edelweiss, since it came from composite resin, and composite resin is the material, dental material that is closest to the natural tooth, but it is only the raw material of Edelweiss, which is the equivalent after the processing becomes vitrified glass. Now, as you can see, a lot of dentists again will say, oh, I do not have a case. I will just buy Edelweiss when I have a case. Again, that is very wrong. Edelweiss can actually treat almost 90+% of our cases. You do not have to wait until you can ideally find on what you think can be treated by Edelweiss. Like, for example, abrasion and attrition. As you can see on the screen, even if you can treat it with composite, majority of the time that composite will not last. Why? Because bonding on dentine, when there is abrasion and there is exposure of dentine, the bonding of dentine is very weak. And since the incisal part is the one that is abraded, which is the stress-bearing area, of course, after a while, your composite will not last long. Plus, there is a difference on in terms of solidification of the material with your tooth structure. Since Edelweiss is created in a factory that is already solidified, so it acts as a one unit already that you already cement on the tooth. So the capacity of it to be able to absorb the force and be able to last longer, it has a higher possibility than direct restoration. Now, the next is, again, the diastema, which is similar to what is on my lower teeth. And the diastema, you do not have to create tooth preparation just so that the composite has something to hold on to when you try to build it directly. I have been teaching direct restoration for more than 18 years. And true, direct restoration is good. I'm not saying it's bad. But why make your life difficult when there is a material, if you need to close a diastema, that all you have to do is slightly prepare it or roughen the tooth so that there will be additional mechanical retention, and then just cement it. See? And then it can even last longer and it will not stain on your patient. Another case that you can use Edelweiss is this colored teeth. Now, this you can combine with tooth whitening. Earlier in the video, you saw a guy who is a Filipino that was treated by Dr. Stefan. And that guy is my co-host in YouTube. Yes, I I am in YouTube for a year now. And he is my co-host and he has a relapse in braces, okay, in orthodontic treatment. He doesn't want to go through again another treatment of orthodontics. But before we corrected his bite, I did a whitening on him. And that is why the natural tooth looks so nice when the Edelweiss was placed, because Edelweiss is translucent. Whatever is in the back will reflect outside. And we just used a composite resin of Edelweiss that is also translucent. And that is also what I love about Edelweiss. You don't know that the person is wearing a veneer. If you will meet me personally and you will look closely on my lower anterior teeth, you will never know that I'm actually wearing a veneer. Why? Because whatever you see in the shade of my teeth is my actual shade. So this is the same. If you're trying to cover a discolored tooth, all you have to do is slightly whiten it. If the patient doesn't want to whiten it, then use an opaque shade that will cover the discoloration. Now, however, on this case, as I'm saying, Edelweiss is very thin. So if the discoloration is very dark, then I suggest you whiten it first and then you do the Edelweiss with an opaque shade of dentine shade. Now, this is a case that we did in our clinic, and this is tetracycline stain. This patient keeps on coming back every at least 1 to 2 years. Why? As I mentioned, composite resin normally stains, discolors, lose its sparkle or shine. So we tend to replace it every 2 to 3 years, especially in the front. This is one of our earliest cases of Edelweiss. And you know, because we did the Edelweiss on this patient, the patient was so happy to the point that this patient referred to us around 8 more patients. So see, that is what is nice about Edelweiss if you do it right. If you do it right, I am telling you, your patient will be very satisfied and they will end up referring more patients to you. Another is tooth anomaly, like for example in peg-shaped lateral. In peg-shaped lateral, normally we ended up doing tooth preparation just so we can make it look like a natural tooth when we try to build it up. But if you use Edelweiss, you do not have to damage the tooth. That the only mistake the tooth has is that it has an abnormal shape and a smaller shape. But what do we do with peg shape? We ended up even making it smaller and removing more of the tooth structure just so that we can place our composite when it is not even necessary when it comes to Edelweiss. Now, the next is, this is the case that you've seen also in the video while we are waiting for some of the participants. And this is the guy who is suffering of amelogenesis imperfecta, wherein the enamel is damaged, genetically speaking, or upon birth. Now, as you can see, before Edelweiss, majority of the dentists, what they will do is just extract the tooth, see, and put, artificial teeth. Why? We all know that the best tooth structure is the natural one. No matter how good you are as a dentist, the natural one is always the best. So, what happened there? Dr. Stefan just did a root canal and removed all the decay and placed Edelweiss. And this will not happen with direct filling. Why? Because again, bonding is very much affected in cases like this. But since Edelweiss is manufactured as a solid material, that all you need to do is cement it using your regular composite. You do not even need a luting composite or a special composite to cement it. All you have to do is use the composite that you have in your clinic. Of course, the best composite that you have to use is the composite recommended by Edelweiss. But if you do not like to use Edelweiss in the composite part, just make sure that you use the nano hybrid with a very good quality and strength. Because Edelweiss gets its strength from, of course, the cement that you are going to use to install it on the natural tooth, on the cement, on the composite itself, and on the tooth itself. Okay, so if you are going to use other composite and it gets debonded or it gets to break, then it is not anymore the fault of Edelweiss. As I mentioned earlier, you can also use this as for misaligned. Just like the co-host I have with YouTube and what you saw on the video earlier from a Filipino guy. And actually, he is very happy with his teeth, and his restoration is now going for 2 years. And his restoration is complete rehab, okay? Now, this is also another best function of Edelweiss for fractured tooth. See, if we are using a direct restoration here, again, we will end up doing more of the tooth reduction so that it can accommodate either a crown or our direct filling material. But with Edelweiss, you can just rebuild it with composite, reshape it, and accommodate Edelweiss as the final facing of the tooth that you are trying to restore. Okay, this one is a case that was presented to us when we were training for Edelweiss by Dr. Claudio Novelli. He is the Italian dentist that you also saw in one of the videos that was presented earlier. So on this case, a lot of our geriatric patient or older patients who have already mobility in their teeth, the tendency is we place a splint in order to, or fiber reinforced matrix in order to stabilize the tooth first before we do our final restoration. By using Edelweiss, the patient doesn't have to go out of the clinic showing the fiber reinforced matrix. They can actually go out to the clinic with an Edelweiss and the fiber reinforced matrix inside it. So this is how flexible the material is. And that is the reason why it is not true that you do not have a case in your clinic and that you have to wait later on before you will try Edelweiss. Now, another is when you do a splint treatment in your patient. Of course, after your patient uses the splint, there will be a space that will be created because you increase the vertical dimension. And that is space that is created by splint to correct the bite of the patient can be closed by Edelweiss. See, so you do not, a majority of the time before, we tend to create a crown instead. So look how invasive our treatment is. The patient just want to correct the bite, but because we created a space in between to correct the bite, we now have to destroy or damage the natural tooth to close that space. Does that make sense? I do not know. For me, before, you are accepting it because there's no other material who can solve that problem without destroying the natural tooth. But now, there is Edelweiss that can solve that for you without reducing the natural tooth so much to the point that you will ended up doing a crown on something that you are just trying to correct the bite. Okay, now this is another favorite material of mine. In my clinic, I love occlusion VD much more than the veneer because this is a very in-demand treatment if you do it correctly. Like, for example, porcelain repair. I have that also on my lower tooth. You see, uh, there is a, on the lower tooth, the porcelain sometimes is cracks. Okay, it cracks and you, but the fit is still good. So the tendency is you do not want to force it by removing it. So for me, I rather have it repaired inside. So I do not want to spend more. The porcelain is still fitted. I do not want to have the hassle. Do you know you know how difficult to do crown removing? So the best crown removal of the crown is by destroying the crown. So if the patient has a limited budget, then this is the best treatment for them. All you have to do is prepare it, and I will show it to you later how easy it is. Okay? So next is uh, the reason why I like occlusion BD is that it is very easy to do. So this is my case. As you can see, my lower teeth, that is my lower teeth before it was treatment. Look at the receding, as a dentist, I am ashamed of how my teeth looks like. So, and look at the root canal treated, and these are all damaged. Why? Because I had amalgam before, a long time ago, and there was no problem. But because a lot of manufacturers and a lot of the news is scared us that you will have cancer, that you will not give birth if you're going to use amalgam. So what did we do 20 years ago? I removed all my amalgams and replaced it with composite. And at the time, composite wasn't that good. Not the composite now. The composite now is good. But when it started, it has a lot of weaknesses. And that destroyed my tooth. See, it was that I did not have a problem, and I created the problem by replacing a very solid, not needed, in removing the amalgam because I was listening to all these scary studies about amalgam. And that's what happened to my teeth, why I have diastema, why there was extraction, why I ended up having a fixed bridge. So as you can see, the spaces there. If I allowed myself to have a restoration or a direct filling, they will have, the dentist who will do it will need to prepare my lower anterior so that it will accommodate the composite. Now, as you can see, that is my porcelain. Okay? I do not want it removed. So what Dr. Stefan did is they x-ray it, they check if everything is okay, that there is no caries inside, and that the fit is still good. So after they checked it, all they did is just to lower it down around 2 to 2.5 millimeters. As you can see, it is a root canal treated tooth. They lower it down and bevel the cavus surface margin. See? They just bevel it. And the reason why they're lowering it down to 2 to 2.5, just to accommodate the cement or the composite resin that will be used as cement for the occlusion VD, and of course for the thickness of the occlusion VD. So then the next is, now on this part, I will show you the initial occlusion VD steps for if you are just starting, because the one that was done by Dr. Stefan, that is for those who are so well versed already in Edelweiss that they do not have to do this step. Okay, now this is the step that you need to do when it comes to occlusion VD. Now, this is an amalgam replacement. Again, this case is so prevalent in our practice. So all you have to do is make sure that there is no recurrent caries. And if there is, you have to remove that. And that is the only area that you have to remove. And then what you're going to do is prepare the occlusion VD. Now, how do you prepare the occlusion VD? It is very simple. You just have to roughen up the inner side of the occlusion VD. After roughing it up, you have to use the veneer bond. Now, if you are going to do Edelweiss, you, especially if you are going to do it for the first time, I truly, truly suggest that you use the materials of Edelweiss. Like, for example, the veneer bond. This is necessary for Edelweiss to bond on the composite and for the composite to bond on the tooth. You have two bonding agents you are going to need. The tooth bonding agent, which is the bonding agent you're going to use on the tooth, and you can use whatever bonding agent you have in your clinic. For example, if you are using 3M or you are using OptiBond or whatever bonding agent you have, as long as it is at least fifth generation, then you can use that as a bonding agent. And then this one is for the bonding agent for porcelain, for Edelweiss, for composite resin. Now, what is the difference of the veneer bond from the tooth bonding agent? This one doesn't have alcohol or acetone or water. It doesn't have anything like that because it is not placed on the tooth. It is placed on the restorative material. So you need the veneer bond, okay? So you place the veneer bond on the back of the occlusion VD, and then you thin dry it. Do not make it very thick, and then you cure it. Now, when you're curing it, if you are not using a quality light cure unit, then you have to make sure you cure it for 20 full seconds. Okay? And then you roll the composite, okay? And then you place it at the deepest cavity of the occlusion VD. Do not press it, just allow it as a roll ball because you want it to spread naturally as you placed it on the tooth. Now, this step is very critical. You do not etch, do not bond the tooth. Okay? Why? Because what you are trying to achieve here is to get the shape of the tooth that you prepared to mark at the back of the occlusion VD. Because of course, when you get the occlusion VD, the design at the internal part or interior part of the occlusion VD is the shape that is done by the factory. But of course, once you are doing a natural tooth, it will have its own shape. So you need to get it. So that's why when you roll the composite into a ball, do not flatten it out because once you press it, tell the patient to bite, okay? Bite slowly, cure it, and now you can remove it from the tooth. Why? Because you did not etch, you did not bond the tooth. And that is where you got the correct shape of the tooth on the first part. This is the part that Dr. Stefan did not do on my porcelain because he is already an expert. But for us who are not yet an expert in trying to assess the shape and positioning of the occlusion VD, then you have to do this step. So, since you already have the actual shape of the occlusion of the posterior tooth that you are trying to repair, this will not move anymore. Now, since we have that, you can now cement it. You can now etch and apply bonding agent on the tooth, then cure, and then again roll a ball of composite. But this time around, you are now going to spread it. Why? Because this time around, you are going to cement now the occlusion VD to the tooth itself. See? So, you are going now to put it back on the tooth, and this time it will not be moving anymore because the shape of the back of the occlusion VD is the exact shape of the tooth. So, you just press it, okay? Spot cure it, tell your patient to bite, remove the excess, and then finish, polish the restoration, remove the premature contact, and voila, it will look like a natural restoration. And that's what happened in my porcelain repair. That was done by Dr. Stepan. But as I've said, he did not do uh, the first step that I show you, wherein he got the shape of the porcelain, because he's already an expert. What he did was directly cement it and just remove the premature contact, remove the overhangs, and then finish and polish. And that is what is the ending of my porcelain repair. See how beautiful that is. And I do not have to suffer as a patient for it to be removed just because the porcelain cracked. Okay? So that is the entire posterior that was repaired on my lower. Now, as I've said, my favorite function of occlusion BD is the amalgam replacement. Again, this one, you do not have to worry about the pits and the fissures and all of these things. And we know, just like in washing hands, majority of patients and even sometimes dentists themselves, they don't brush their teeth at the proper amount of time. So these can result to decay and of course disintegration of the enamel. And just like in washing hands, we do not wash our hands at the proper amount of time. So with using an Edelweiss occlusion BD rather than direct restoration, wherein later on this can result to leak, this one looks so nice. That's why I wanted my upper to have occlusion BD, and hopefully I will be able to get a schedule soon with the dentist, because just like probably in Myanmar, in the Philippines, the appointments for dentists are first has to be critical, and then if the dental clinic is already ready with the situation to address the infection control, then actually nowadays we are already allowed to treat not only emergency but almost all dental procedure. Now, this is another function of occlusion BD that I really love. Now, basically, in cases wherein there is a single missing tooth, our treatment is either removable partial denture or fixed bridge. So, of course, in removable partial denture, this is not so ideal aesthetically. But if we do fixed bridge, the problem with the fixed bridge is that you need to damage the two of the abutments just so you can replace a single tooth. With Edelweiss, you don't have to. You can create a wing like a cantilever or Maryland style by using a fiber reinforced matrix. Now, however, on these cases, I do not suggest you do it if you are just starting Edelweiss. My suggestion to a lot of dentists who wants to try Edelweiss and do it right is do something simple first. Try to build your capability of handling and doing Edelweiss first before you go to complicated cases. A lot of dentists loves to do complicated cases with Edelweiss when they have not done it ever. So, in the end, the mistakes becomes higher. Why? Because they're not used to it. And as I mentioned before, oftentimes because the brain is so used in handling porcelain, in composite, the tendency is we handle Edelweiss the same way. And these are two different materials that can result to a lot of error in terms of placing it and putting it on the patient's mouth. Now, this is another case that I have on my tooth, and this is the post and core. Again, the endo or the root canal treatment was done in the Philippines, and then they have to double check if the root canal was done well. And as a dentist, of course, I will choose one of the best dentists in the Philippines, especially since I'm also a dentist. So the one who did the root canal is a good friend of mine, and I truly respect him as a dentist. So what is nice about the post and core is that you just have to etch the canal, okay? You just like initially, like any other post and core, and sometimes I wonder why dentist still requires training when post and core of Edelweiss is just like the same when you are doing post and core. Of course, you have to use the specific drill that is provided by the post and core brand that you are using. So you go down to the proper depth, clean it up, disinfect it, and then, depending again on what the material, if it is metal, glass ionomer, if you are using composite, then of course, you need to be able to etch it and apply the proper bonding. So of course, once you clean it up, you make sure the canal is totally dry and free of the etchant. And then you place the bonding agent. And then of course, you cure. Now, what is nice about the post and core of Edelweiss is that it has a translucent lighting guide wherein you do not need a dual cure cement because the light can pass through from the top to the tip of the post and core because of the lighting guide. So you also do not have to create the core because it already has a core. So all you have to do is place a flowable, which is Edelweiss has. And again, do not use any other flowable because the flowable composite that you may use is very weak. But when it comes to Edelweiss, it is highly filled. So this can handle the required strength necessary for post and core. So they just cement it, cure it, fill up the the area where the junction of the post and core and composite is, and there you go, as you can see. And then of course, now the final restoration is the occlusion VD. So there you go, they just placed it. Okay. And as I've said, since Dr. Stefan is an expert of handling this material, he doesn't get the impression anymore and just directly cement it on the tooth. I do not advise you to do that. unless you are already well versed in handling occlusion VD. And then he turns the occlusion VD into a crown by applying composite all over. Now, you have to tell your patient that yes, the occlusion VD will not stain, but any composite that is created or added on the occlusion VD to make it as a crown will stain because that is composite resin. So that's how it looks like. And again, I am very satisfied with the result. Now, before I proceed with the important reminders, is everybody still okay? Do I proceed? You have an icon that you can, do there you go. Thank you, Anonymous. Thank you. Hintikyao. Yeah, thank you. So, okay, so I will proceed now on the things that you have to remember so that you don't make mistakes when you do Edelweiss. The first reminder that I have to emphasize is that you have to treat the main cost first. Sometimes a lot of dentists thinks that Edelweiss is the cure of the situation. For example, if there is a problem with the bite, they use occlusion VD as to correct the bite. No, to correct the bite, you use the splint. The final restoration is occlusion VD. If there is class 3, then remove the class 3 first. Then you fill the cavity with composite. But if you want it to have a full look, then you place Edelweiss veneer. That you have to remember. It is not like, for example, if you have class 4, you do not use the cement of the Edelweiss to fill up the class 4. You fill up the class 4 first, remove the decay, and then you place and cement Edelweiss as the final layer. So always treat the main cost first because Edelweiss is a restorative material, a final restoration. It is not to correct anything else except provide restoration and provide aesthetics to your patient. Okay? Now, the next thing that you have to remember is always roll the composite. Now, rolling the composite before placing on the tooth is a very important part, not only for Edelweiss, but for direct restoration. Because when you roll the composite becomes compact and there is no like air spaces in between. So just like earlier, when you try to roll a composite and place it on occlusion VD, do not flatten it out because if you want it to get the impression, the initial impression of the tooth you are trying to repair, you want it to like spread properly. And then only on the second step that you roll it, but you then spread it. So that is the second reminder. The third reminder is you get the correct shade. Now, this is my tip to you. Please, if the patient is happy with the shade of their teeth, like me, when they did the Edelweiss on my teeth, I am happy with the shade of my teeth. I don't like to make it look artificial. I don't like it white. So, if your patient is happy with the color or shade of her teeth or his teeth, then just use the enamel shade of Edelweiss. That's it. That's it. Edelweiss, enamel shade, and then it will reflect the natural color of the tooth. You do not have to make it complicated. However, excuse me, however, if the patient wants it whiter, especially nowadays, a lot of patient wants it white as if it's not, it's like chiclet already. I don't know if you know chiclet. This is the chewing gum that looks like, square that looks like a horse's teeth, because it is so white to the point that the teeth is in front of the face already. So if the patient likes that, then you just get A2, A1, the dentin shade, and combined it with the enamel shade of Edelweiss. And then if you have extra time in your hands and you want it even better, then you can use effect shades like effect blue. Now, all these steps, I gave it to Wang already. He has the entire uh, cheat sheet for Edelweiss. So, later on, I think he will provide you the links wherein you can download it. And then later on, if we will have a chance to do a webinar that can do hands-on, then hopefully you can also attend. So always remember, if there is nothing wrong with the shade, then just use the enamel shade. Don't make it complicated. Okay, number 4. When you are trying to prepare the shoulder or the chamfer, it has to be supragingival, not not subgingival, but supra, because you do not want to have a leak. Remember, composite is hydrophobic, and anything inside on the gingiva, like for example, porcelain, as I mentioned, just like any other dentists who are so used in handling porcelain, when they handle Edelweiss, they tend to create a subgingival preparation. And this will not do because composite is hydrophobic. So if there is a leak, then it will have more problems. So it has to be supragingival preparation. Another is, normally, again, in porcelain, when we are trying to do tooth preparation, our tendency is we will separate the tooth and remove the interproximal, the proximal junction of every tooth. You do not have to do that. You just have to uh, adjust. But it is not necessary. See, that is the reason why, as I mentioned earlier, if you apply what you know about porcelain and apply it to Edelweiss, you make it even difficult for you when it is not even necessary. That happened to me. That's why I know. My first case, I removed the contact because that is what I'm used to. But with Edelweiss, if there is no need for tooth preparation, then you just have to roughen the surface. That's it. And then create a certain uh, shoulder supragingival, so that when you place Edelweiss, everything is well, uh, you know, uh, laid down, or the junction between the tooth and the Edelweiss is properly done. Another thing, do not reduce the incisal until the Edelweiss is cemented. Okay? Until it is properly placed. Why? Because the tendency is you might over-reduce the Edelweiss. As I mentioned earlier, the thickest Edelweiss is on the incisal edge. So if you are reducing the incisal or reshaping the incisal edge of Edelweiss when you still do not have a guide on how long you need it, the tendency is you might you might be reducing too much. So reduce only the incisal once you are already finishing and polishing and you're just now trying to establish the smile line. Okay? The next thing that you have to remember so that you will not make mistakes in Edelweiss is that make sure before you cement it, the Edelweiss is not contaminated with bacteria. If you can, try to buy something to disinfect it. This is also good not only in Edelweiss but in your porcelain, in Emax, all this indirect restoration requires disinfection as well. Why? This is the reason why sometimes there is a black or bluish discoloration that happens on the cervical area. Why? Because the restoration is contaminated with bacteria. So you try to clean it up either with a alcohol swab or you can use chlorhexidine and then just dry it out. Okay, so just make sure that your Edelweiss before you cement is not dirty or contaminated with any other than the composite that you're going to place it. The number 6 is at least use, as I mentioned, either use a 7 generation, but fifth generation is okay as well. You can use excuse me, you can use whatever bonding agent you use in your restorative filling, but make sure that it has a very high bonding strength. Okay, so that is something you have to ask, what is the bonding strength of the tooth bonding agent you are going to use. Okay, the next is okay, the next is, this is another very critical. Always check the canine guidance. This is true whether it is Edelweiss or not. A lot of dentists, they don't check canine guidance when they're doing direct or indirect restoration. Now, the canine guidance means when you do lateral excursion or movement, the tip of the canine of the upper and the lower are touching, but the posterior are totally disengaged, okay, or not touching each other. So you have to always check canine guidance because fracture always happen in lateral excursion, not in biting like that, okay? Next is again, you have to check the overjet and the overbite. Like for example, with my case, Dr. Stefan has to check if I have enough space to accommodate Edelweiss because you do not want to have a very protruded Edelweiss. You need, this will define whether you will need to do tooth reduction or not. For me, I don't need it because I have enough space. So that is what you have to check. The overjet and the overbite at least have 2 mm and 4 mm. The next is the vertical dimension. Again, this is very important. A lot of the cases that Charlie or Wang provided me before when I taught Edelweiss in Myanmar, majority of the cases, they have a problem with vertical dimension. It means there's not enough bite or, you know, proper bite of the patient, like deep bite, you have to correct all these things. Because as I've said, the number one thing you have to correct first is the main cause. So if the patient is having a collapse on they have a TMJ problem, they have a collapse bite, then you have to correct it first. There's no other way but correct it first. Because no matter what material you're going to place it, it's going to damage either the restoration or the natural tooth. Let's just say you have a deep bite and you place porcelain because you said, oh, it's durable. But you see, which one gets abraded? It's the natural tooth. Why? Because yes, porcelain is very strong, but because there is a problem with the bite, so when the patient is like uh, eating or if they brush, the tendency is the weaker part of the teeth will be the one that will be abraded. And if you are using zirconium or porcelain, then definitely it is the natural tooth that will get affected. Now, as a dentist, if you just like this, if you just like money, you really don't care. You know, you don't care because you will earn from repairing their natural teeth. But my question is that the kind of dentist you are? Now, that's the only question that you can answer for yourself. So, as I've said, there should have at least a minimum of 40 millimeters of vertical dimension from the upper vestibulum to the lower vestibulum. So, at least 40 mm. Now, if there is a slight lower, like 38, 37, you have now to decide the condition like the canine guidance, the overjet, the overbite, and decide for yourself whether you still need to treat the patient with a splint or you can just directly restore or increase the height by using occlusion VD and the veneer. Okay, now number 11 is please remove the premature contact. Because again, a lot of the times we do not polish, finish it properly to the point that there's a premature contact. And as I've said, always remember, if there is a problem, Edelweiss will protect the natural tooth. So it will be the one to break. It will break because it wants to save the natural tooth. And that is why I like this material, because it is more concerned on the health of the natural tooth rather than saving itself. Now, make sure that when you cement it, it is totally sealed. Now, as I've said, it does not stain. If it stained, it because there's a leak and that it went inside. So make sure that all the connection between the tooth, the composite, and the Edelweiss is properly sealed. Okay? So, of course, if you have a very good end result, you will have a happy patient equals a happy practice. So, that is my lecture, but I will show you how to do the veneer because, again, it is really very easy because the procedure of Edelweiss is just like any other uh, veneer preparation except with certain changes because the material is not porcelain, it is not zirconium. Another thing I like about Edelweiss is that it is very easy to polish and finish. You do not need a special polisher and finisher like zirconium. And then if it breaks, then you can repair it with composite because it is very compatible with composite because its original raw material is composite, even though it became vitrified glass. Okay? However, if you repair it with composite, always remember that that composite will stain. The Edelweiss will not stain, but the composite that is exposed or you used for repair will stain because that's composite. Edelweiss is already vitrified glass. So what do you do with the veneer? Very simple. First, you assess everything else. You assess the bite, as I mentioned. You assess the overjet, the overbite, the canine guidance. Then the next is you have to get the size because this is like a pre-made dress. So you need to know whether it is small, medium, or large. Now, again, you can choose the shade if you want, but as I've said, if the shade is okay and the patient is happy with their own shade, do not make it complicated. Just use enamel shade of Edelweiss. Okay? And then, this is what's nice about Edelweiss. You can actually pre-trial it directly. So, you can use an expired composite and just place it on the tooth to see what adjustments you need to do. You can actually use this for marketing as well because you can clean it up later and autoclave it because Edelweiss is autoclavable. So once you know that it fits, then you will just have to roughen up, okay, to roughen up the tooth. As I've said, if it's not necessary, then you don't have to do the typical tooth preparation. And then you roughen up the back of the Edelweiss. Now, again, there are special techniques you can do if you want additional characteristic, but let's not complicate things first. Just do the simple stuff and do the advance of Edelweiss later on once you've already handled a lot of Edelweiss cases. So just wrapping it up and then actually etching the Edelweiss is not necessary. The only reason why we etch it is to make sure that the bacteria is gone. And then you wash it off, you prepare the tooth, you etch the tooth, you bond the tooth using your tooth bonding agent, and then you also bond the Edelweiss with the veneer bond. Okay? You thin dry it, do not make it thick, and then you cure it. And then place the regular composite. And as you can see, you do not even have to have a special instrument to transfer the Edelweiss to the tooth. You just need to stick the interproximal carver on the composite. Now, isolate it properly. Use a very good celluloid strip. And then you just place it. Now, this is very critical. You do a point cure of 1 to 2 seconds once you properly positioned it, but do not fully cure it yet because the only reason you point cure it here so that it will not be moving like that while you try to make sure and spread and seal the sides. See? Because by doing a point cure, the veneer will not be moving or going to be misplaced while you are adjusting everything. Okay? Because all the other composite is not yet cured. So, and then, so little by little, as you go and proceed, you cure it. And then once it is done, you just finish, polish it, remove the excess, the premature contact there. Then you can adjust also the incisal edge and do the finishing and the polishing, check the bite, and that is it. Now, I would just like to show to you this package of Edelweiss, because this is not normally offered to everyone. This is offered to third world countries like ours, because they're trying to make sure that you have all the materials you need uh, in order to at least do the initial Edelweiss. I'm trying to, just a sec. I will try to find the the picture of the intro kit. There you go. I would just like to explain to you, because later on, when I pass Wang's to Wang, because I'm done already. I'm just going to show you the kit, and this is very important. This is what's nice about this intro kit, because you can do an initial treatment of Edelweiss with everything already in it. As I've said, it is like cooking. It's like doing anything for the first time. Try first to follow the instruction of the manufacturer to the letter. Use the materials that they used. Now, after you get used to it and you already know exactly what to do, then now you can do a little deviation if you want, and that is only if you want later on. But if you're doing it first, try to use the veneer bond, have the sizing guide, everything is already in it. The burr that must be used in the reduction. So this is the very best way to start an initial kit when it comes to Edelweiss. So anyway, that ends my lecture. Thank you so much. If you have any questions, feel free to ask. Yes, the ideal vertical dimension from upper and lower vestibule is 40 mm. That is the ideal. But, you know, there can be a slight deviation. So it really depends. So it depends on what the entire picture of the bite. But ideally, 40 mm. If the patient has a bite, correct the vertical dimension, yes. If the patient has a deep bite, it is very necessary that you correct the bite first. There is no existing restoration that will not get affected if there is a problem with the bite. Even the natural tooth gets abraded if there is a problem with the bite. If there is cross bite, deep bite, overbite, all these things, you need to correct it first, because it, whatever it is, it will get affected. Okay. Now, basically, when it comes to vertical dimension, as a dentist, especially for those who have been practicing for quite some time, you already know by just looking at the patient if there is a problem with the bite. Okay? And then if you can already assess there is a problem with the bite, including with the signs and symptoms, then that's the time you have to decide whether the patient needs to go through the treatment of the splint. Yes.
Hello, Dana.
And when it comes to premature contact, that's all the rules of Edelweiss is actually almost the same as to
Hello.
every restoration available.
Infantile.
Okay, so Wang will be providing you the step-by-step guide, the catalog, and I also provided him my certain tips before when I lectured in Myanmar.